Hello everyone, my name is Juan Velasco. I am a student at EPCC's dental hygiene program. Today I will be talking to you about the different types of dental caries a person can have in their mouth. You might have gone to the dentist one day and have been told that you have a cavity. Well, did you know that there are different classifications for dental caries according to where they are in the tooth and mouth? These are known as Black's classification of dental caries, and they were developed by Dr. G.V. Black in the late 1800s. They range from 1 through 6, and it is important to learn this as a first-year dental hygiene student as well as a dental assistant, not only for national boards, but for everyday descriptors while in the workplace. First, we'll begin with the Class 1 caries. So the Class 1 caries involve the pits and fissures of the teeth, particularly posterior teeth, or in other words, the back teeth. These include the occlusal surfaces, which are the biting surfaces of the teeth. And then they can be hard to clean in the pits and fissures. That's why they're very prone to caries. And then a way that we can deal with that is by applying dental sealants into the grooves of the teeth, to the pits and the grooves. That way it'll help protect the teeth from getting cavities in there. Up next is the Class 2. So the Class 2 dental caries includes the interproximal contacts of posterior teeth, or your back teeth. And they are commonly diagnosed with radiographs because you can't really see in there clinically if they're kind of small, so they'll show up better on the x-rays. And then they are the most common of all the dental caries. And one way to help protect against these kind of cavities is to ensure proper flossing and cleaning between your teeth. So up next is the Class 3. The Class 3 is similar to the Class 2 in that it involves interproximal surfaces, but unlike the Class 2, the Class 3 involves the interproximal surfaces of the anterior teeth, or the front teeth. And just like the Class 2, they are diagnosed better with the radiographs. And also like the Class 2, the Class 3 dental caries can be prevented by flossing and cleaning better in between your teeth. So up next is the Class 4. So the Class 4 comes as a result of a Class 3 not being treated. So it involves the incisal angle of the anterior teeth. So as you saw earlier, the Class 3 began here, interproximal between the teeth. And if left untreated, it's going to keep going down and down until it involves the angle of the tooth up down to the incisal edge. Next is the Class 5. So the Class 5 dental caries involves the gingival third of the facial and the lingual aspects of the tooth. So what that means is it's going to be right at the gingival margin. And by facial and lingual, it means that it can either be in the front of the tooth or in the back of the tooth. And then this involves either front teeth or back teeth. So anterior teeth or posterior teeth. And in these kinds of dental caries is where you probably see more composite material being used as opposed to amalgams that you would see on a posterior tooth. And finally, we have the Class 6 dental caries. So the Class 6 involves the cusp tips of posterior teeth, as you can see here, just right at the tips, or the incisal edge of anterior teeth. The incisal edge is right here, where you used to bite. And then it's one of the most rare types of cavities, and it typically happens in older patients once their cusps have been really worn down just from eating and chewing and stuff their whole lives. In conclusion, we went over Dr. G.V. Black's classifications of dental caries from Class 1 to Class 6. Hopefully this helps clear out some confusion about the different classifications, as well as provides extra examples to help you learn them better. Thank you for tuning in, and remember, plaque is whack.